My friends. Hello, my friends. My name is Melissa Godfrey. I'm a nurse here at Rhode Island in the US, and I'm also an MPH student at Brown, which is where I met our dear friend, Dr. Khalid Amaji. I'm coming at you live to explain what we're doing and why. So as the war in Syria is continuing, few health facilities remain, white helmets and the people of Syria continue to be attacked regardless of any ceasefire agreements. And health facilities are the only place where wounded people by barrel bombs and discriminate attacks can be treated. So the clinics where children and women visit for diseases also are not really existent anymore. Those also are an attack. So healthcare facilities and hospitals both are being attacked. So families that are in Syria are afraid to go to these clinics if they're seeking care for a disease that is not related to trauma from an attack, because right now they're just too unsafe. Pregnant women prefer to risk their lives giving birth at home with no midwives, with no healthcare personnel, because the hospitals and the clinics where they would go to are too dangerous when they're being attacked daily. The distance also from any maternity clinics is very far from Idleb, Syria, where we're building this hospital. And so there are some clinics where women are going to schedule C-sections or cesarean sections to remove the babies, but they're quite far away, and we can't always guarantee that they're going to be open due to attacks or that there will be the health staff that they actually need there. Right now, currently in the past 6 years from the war, about 770 to 880 healthcare personnel have been killed in Syria. Also, many other thousands are being imprisoned for providing care during the wartime, and many more thousands have fled the country because it's too scary, it's too unsafe. Healthcare has to be a right for all humans, and we have to ensure this right to our Syrian friends. They're suffering every day from all types of war crimes, including the chemical attacks that we've heard about with sarin and chlorine. In addition, thousands are killed, unfortunately, daily due to the airstrikes and the barrel bombs from both sides. And they're predicting up to 1,000 people have been killed in Syria from the beginning of the war. In these areas are under attack by the Syrian regime. And even though they're under attack, they want to stay home. They want to stay in Syria. They don't want to be refugees. But when they don't have access to healthcare, and recently the Syrian-Turkey border has been closed for the past 20 days. So even those who have serious medical conditions can't go over there to seek medical care. What are they supposed to do? They need care where they are. And that's why we really need to open this hospital. If we don't want them to be refugees in other places, we need to make it safe at home for them. And we're going to do that through this hospital. Khalid, I'll pass it over to you.
Hi, thank you, Melissa. Actually, here in Gaziantep, like just 50 kilometers from the Syrian borders. First, I'm Khalid Al-Milaji, a Syrian doctor here in Turkey. Actually, maybe I can start from my story. I'm a Syrian doctor. I've been studying a Master of Public Health in Brown University in Rhode Island, and I came here to just to follow up on on my humanitarian team in Gaziantep, Turkey, in January when I lost my visa to go back and to continue my studies. Actually, this is a story of a doctor who has a passport, who has a scholarship, who has everything legitimate just to seek some experience to go back to his country and to work on the health system here. So on the other hand, when we talk about people, they lost their passports, they lost their properties, they are displaced inside Syria, they are in Syria, they cannot cross the borders. And actually, most of them, they don't want even to be refugees. They don't want to cross the borders, and they want to stay there in homes, even under the shelling, under the bombs. So when you imagine that 43 attacks against health facilities just since January 2017, and more than 15 ambulances destroyed since then, like in 4 or 5 months. and 8 healthcare providers has been killed and many injured in those health facilities because of those attacks, and many civilians have been killed in those attacks on the health facilities. Beside the thousands has been killed in the cities and towns shelled by the different kind of airstrikes, plus as Melissa mentioned, the chemical attacks, sarin attacks lately, where 100, like almost 90 persons, including kids and women, have been killed in the morning silently. Unfortunately, 500 were injured. Actually, when you look at this brutality, and you know that the hospital which was receiving those injured from the sarin attack actually was bombed just 3 hours after the chemical attack. What kind of brutality we are talking about here? So when we are talking about trauma and the hospitals that they are receiving the current injured and affected people of the attacks, what and where the regular patients and where they have to go. Actually, women and maternity and pediatric medicine and most of the non-trauma medicine have been neglected since 4 years because there is no medical staff enough to deal with the trauma and emergencies and with the regular cases. So you see most of the makeshift hospitals and the field hospitals are dealing mainly with the emergency cases, and they just specify small places and time for the non-trauma cases. And actually, with the continuous attack on health facilities, patients they do not prefer to go to the hospitals and to the clinics. Actually, they prefer to suffer from the diseases home rather than going to any health facility. And actually now, and even the borders with Turkey, where people and families, they have to take their kids, or women have to go to the borders, crossing tens of kilometers and wait days and after days to take permission to cross the border to seek healthcare in Turkey and to come back. It's not available always, and it's very expensive for those people. It's normally there should be for every 100,000 people a primary health care or a health facility or a hospital, but this is not the case in Syria. So what we are talking about here, that those people who decided not to go out of the country, there is almost, if we are talking about Idlib and the near countryside of Aleppo and Hama, there is almost 4 millions. Those people are under attacks every day, and the ceasefire is not active, and it's not working most of the times as we saw. So here we are talking about providing safe places where doctors can really treat people, and they can even go to the operation theater knowing that they can spend even continuous 2 hours focusing on their surgeries. We know about Dr. Darwish, who has been killed in the hospital. Why? Because actually the hospital was not bombed, but the entrance of the hospital was attacked by a chlorine barrel bomb. Actually, he was with his patient. He was completing his surgery while the chlorine invaded the hospital. He preferred to continue the operation till he just helped his patient. And then the other staff, they took the doctor to the referral hospital, but he was really exposed to a lot of chlorine and he died. So here we are talking about providing a place where doctors can save people from trauma and non-trauma cases. We are not talking about luxury here. We are not talking about a hospital in every town. If you count the hospitals and the health facilities available now for 4 million people in this area, it's even far, far, far away from the sphere standards and from the humanitarian standards. So we are talking about here providing the minimum number of underground hospitals or safe hospitals, because even underground hospital will not even challenge the Russian airstrikes. So here, in our case here, we want really to make sure that at least women and kids can receive the services which guarantee that to save their lives and to improve, like to provide the minimum quality of health, like care to them. So with this high, with those services, we can avoid the cost of traveling tens of kilometers to seek like healthcare in facilities which are most of the time exposed to attacks. So here the solution is a safe place where we can provide more vacancy and capacity to receive women and pregnant women and kids. So we in Care for Syrian Kids campaign is advocating for Avicenna Hospital, which is a referral hospital in Idlib city. It's a women and children hospital. It's a The rehabilitation works in the basements, -1 and -2, has been like working on since maybe 7 months. And now we need some support to complete the rehabilitation and fortification of those 2 floors. Of course, there are like almost 7 floors empty to provide more protection for those 2 floors under the ground. And of course, we have to complete the rehabilitation and to equip and to run the hospital. So this hospital will be a referral hospital. And according to the health group and health cluster here in Turkey, working cross-border for Syria, we need at least from 3 to 4 referral hospitals in these areas, because the number of deaths, because of the complications of the normal diseases, which in the normal cases, it's very easy to be treated and handled by the health staff. Actually, health staff are leaving the country, or they are not going to the health facilities because of the safety. So the solution is a safe place where doctors can be safe and patients can be safe. So what we are doing now is to advocate for for safe hospitals, advocate to spare hospitals, to advocate to the parties to the conflict to keep health facilities safe. Do not attack health facilities. We will work on the facilities. We will protect them. We will try our best to protect our doctors, the remaining number of doctors. Actually, such referral hospital, we can also, the target is to train more and new nurses and midwives and even residents who couldn't complete their residency program in the regime areas and they left to the opposition areas. They can even there, under supervision of more skilled doctors, learn life-saving procedures. So here we want to support this hospital as an action, and so we are doing advocacy, and we will complete this hospital and to provide this crucial and like very important services to those people in Idlib and in this region. Yeah. So I don't know if Melissa have anything to say or to add.
Yeah. I'm just going to add one last part. So as a support and part of our advocacy portion of the campaign is that Sundays we're doing big Twitter and Facebook storms. And so this is when we're asking you all to join in and help show support. Last Sunday, we had all of our contacts in Syria, the doctors, nurses, children, white helmets, civilians holding signs saying, please stop attacking us, stop attacking our healthcare. And then this Sunday, today, from now, for the next hour, we're going to send signs, posts from Facebook and from Twitter saying, we stand by you, we hear you, and we will work with you to help protect your healthcare. And so from our Twitter and from our Facebook, care, the number 4 Syrian kids, we're going to be posting And we're asking you guys to please all like, share, and retweet. This is a technique that is used in media campaigns to get hashtags trending, and that's a great way to get the attention of international NGOs, government officials, and people who can truly have an impact in funding this hospital, assuring that it is open and run, and also hopefully to show support to our friends across the sea.
Yes, yes, absolutely, Melissa. We have to show people that we hear them, we are with them, we care about them, wherever we are in the North America or South America or Europe. Like, do not at all consider like individual like participation, whatever it is small, like a tweet or participation or like even a share on the Facebook will do a lot of like work for our campaign. So please don't underestimate your like individual role in this, everyone, guys.
We really appreciate your help. So we'll see you on Facebook and on Twitter now.